And if you have a stiff aorta, that will come across as high blood pressure. And the answer, like I said, it's not pharmaceuticals, not going to work. The answer is to improve all of that, eat, live, and think, because you mentioned stress, which is a massive, massive, massive factor of all illness.
Welcome back to another episode of the Peak Performance Life podcast. Today, I am very excited to have an expert in one of the most important fields. There's a lot of different contradicting information in this field, and we have America's natural heart doctor, Dr. Jack Wolfson. He is a board-certified cardiologist, Amazon best-selling author, husband, father, and the nation's #1 natural heart doctor. For more than 2 decades, more than 1 million people have enjoyed the warmth, compassion, and transformational power of his natural heart health information, courses, and events. He's the founder of the Natural Heart Doctor, the worldwide leader in cardiovascular health. Doctors from across the globe reach out to Dr. Wolfson for training and education in holistic health practices, which I'm really, really excited to hear what he has to say, because I actually have not heard many holistic doctors in the heart health realm that we're going to be discussing today as well. So he's been named one of America's top functional medicine doctors, 5-time winner of the Natural Choice Awards as a holistic MD, and his work's been covered by more than 100 different media outlets. Dr. Wolfson, thank you so much for joining us here today.
So Laura, thank you so much for the wonderful intro, and excited to talk cardiovascular health with your audience. #1 killer worldwide. So it definitely impacts a lot of people.
Absolutely. Well, let's start with a brief background. Were you always interested in the natural, holistic way of doing heart health, or how did you kind of get to where you are today?
No, definitely not. I was born into the medical matrix. My father was a cardiologist. So I'd like to say that when I was in my mother's womb, I was listening to cardiology conversations from my father and his colleagues. And when I was a young child, that's certainly the stuff that I remembered. My father talking about cardiovascular disease, not cardiovascular health, but cardiovascular disease with his colleagues and stuff like that. So from a young age, I wanted to be just like my father. My father was my absolute hero. He was an amazing, amazing man. And I would do just that. I would become a board certified cardiologist, finished up my cardiology training from Chicago in 2002. And then I moved out to Arizona. I joined the biggest cardiology group in the state of Arizona, where I would become one of the senior partners doing angiograms, pacemakers, hospital-based procedures, all that kind of stuff. Well, a couple of years into that practice, and everything's going really well. The money's coming in, lots of patients, lots of sickness, and everything's good. My father wasn't doing so well. So my career is like exploding. I'm doing fantastic, but my father is getting sick. He's in his mid-50s and he becomes depressed. And we took him to see a psychiatrist. They tried him on meds, and the meds didn't work. And we were like really surprised, because here was a guy who just had everything. He had money, he had success. He loved what he was doing, loved his family. And then he was getting depressed. Well, the depression morphed into like a Parkinson's like movement disorder thing. And eventually he would go to the Mayo Clinic. We would go with my mom, my father, and I. And the Mayo Clinic, the head of neurology there would say he's got progressive supranuclear palsy. It's not Parkinson's, but it's similar. We don't know what caused it, and there's no treatment for it. And he'll be dead on average within 3 years. And we walked out of there, obviously totally dejected. But at exactly that time, I was introduced essentially on a blind date with a 29-year-old doctor of chiropractic. And she told me exactly the reasons why my father is dying, because the food he eats, the lifestyle that he leads, the toxins, all these different things. And then, of course, she says, you're doing the exact same thing. So you're going to wind up in his, you're really going to follow in his footsteps. So what I had, when she said this, it was an epiphany moment, beyond belief. It was pulling me out of the matrix. She is my Morpheus, again, to kind of continue on that analogy of that movie, and pull me out of the matrix. And I like to say that I saw sickness around me. I saw sickness in my father. Mayo Clinic has no idea. 29-year-old chiropractor, she's got all the reasons. And then I would, from there, I would just start to change my personal life. I would change my practice. And then eventually I would leave that big group. My father would die, but his loss is not in vain. It created the man I am today. There's a God-intended purpose for everything. And again, that's what gets me to your show right now, Delora.
Wow. Wow. Amazing story. Thank you for sharing that. So, gosh, I want to jump in so bad into some of these super hot topics as it relates to heart health. We know that heart disease, right, is the number one killer, here. So it's such an important topic. Yet there's so much differing information. I don't know where to start. What are some of the differences, I guess? Let's start with telling people, what are some of the differences in the way that you would treat someone versus a traditional cardiologist, traditional doctor?
That's a great lead in. And I say that because I have an easy answer for everyone who's listening. Traditional medical doctors, or let's just say the mainstream medical doctors over the last 100 years, because prior to that, everything was natural. But once the pharmaceutical industry was born and took over what is now considered mainstream, the mainstream approach is pharmaceuticals first. The holistic approach, the natural approach, is pharmaceuticals last. It's the last thing that we should consider. And that is the fundamental way to look at things. Now, why is the mainstream, again, as I mentioned, pharmaceutical companies control medical education. When I was a medical student, resident, fellow, it's all based on pharma training. We do not get any training in nutrition, in lifestyle, in evidence-based supplements, in the biohacking things. We get zero of that. It's all about pharmaceuticals. And then, of course, the way the insurance industry drives people, when you have very short visits, oh, hello, it's Laura. How are you? Everything's looking pretty good. Blood pressure is a little bit high. I'm going to give this prescription drug. We got some samples over here. We'll see you in a couple of weeks. We'll see how you're doing. It's that fast. That's the conversation that I could just rattle off in my sleep because I did it for so many years. But anyways, that's kind of the main difference, I would say, is that it's that pharma approach. And we think pharma last, which means what is our first approach? Our first approach is always root cause medicine. If someone's blood pressure is high, if someone's cholesterol is abnormal, if someone has coronary artery disease or an abnormal coronary artery calcium scan, or they have whatever cardiac diagnosis, or any diagnosis, whether it's cancer or it's autoimmune or it is brain or it's skin or it's gut, it's always root cause. Why is the person sick? And then once you can identify the why or whys and remove those whys, people start to heal.
Yeah, absolutely love that. Let's jump into this topic that I just cannot wait to get your opinion on. And there's probably not a week or two that goes by where someone, a friend or someone, family member, either sends me a blood test results or says, hey, my cholesterol, is too high. And then we've had people on the podcast we've had hormone specialists on the podcast that are like, no, cholesterol is good. It's the building block for hormones. I worked in a cancer clinic years ago and most of the people had very low cholesterol, and then there's other people who are like, oh, my cholesterols are high. I got to take statins. So what is cholesterol important? Are there better markers like ApoB or some other marker that's more relevant than just your basic cholesterol, total, LDL, HDL? Where do you fall on that spectrum? And then I'm sure we'll get into statins after.
Yeah, this is a big one because it really stems from the original studies that were done in the 1940s and 1950s, where they studied people who were having myocardial infarctions, studying people post-mortem who had died from coronary artery disease. And they looked under a microscope and they looked at the plaque. And what they found in the plaque is that there were a lot of these lipid deposits. There was a lot of cholesterol in these people. So from there, it quickly became, well, if cholesterol's there, then cholesterol is the causative factor. And from there on, I got vilified. And then from a pharmaceutical standpoint, it became, what can we do to lower numbers down from a pharmaceutical standpoint? And there were a lot of drugs that were tried and utilized before statin drugs were discovered in the late 1970s. There was also a lot of dietary approaches to that. And that, of course, was to the benefit of Quaker Oats, Nabisco, Kellogg's. How can we sell the populace on the idea of this cheap food, cornflakes, oatmeal, all these things. And then, it lowers your cholesterol down. So I think there were a lot of different factors that went into the vilification of cholesterol. And it exists today where most people are listening and they think about cholesterol. They don't think about what you just said, hormones, vitamin D, big component of the cell membrane, about our digestion, where the liver makes cholesterol, puts it into the gallbladder as bile to help us digest our food. So we don't really think about that at all. We think about cholesterol as, this causative agent of heart attacks and strokes and this cheesy white plaque and don't eat eggs and stuff like that. It's just, again, it was just a perfect propaganda storm of what they did to us to vilify cholesterol. Now, to your next question, which is about what are the markers that really matter? Total cholesterol does not matter. I could care less what the number is. It happens to be on the panels that we run because it's included and some people are still interested. But to your point, there are much, much, much more advanced markers that we need to be looking at. But even those markers that I talk about a lot, which are apolipoprotein B, apolipoprotein A, if we think about these particles, these LDL and HDL particles as like baseballs, the ApoB is the stitching on the LDL baseball for simplicity's sake. ApoA is the stitching of the HDL baseball. And that's, we've known since the early 2000s that is a better risk predictor for cardiac events than total cholesterol. But even then, I got to tell you, Talora, that I'm not overly anxious to even look at those numbers. I'm much more interested in the markers of inflammation and oxidative stress. Because when you are exposed to things that lead to inflammation and oxidative stress, that is what generates the abnormal lipid or cholesterol numbers, because those are just reactionary. Remember, LDL is not the bad and HDL is not the good. Again, that's pharmaceutical company speak. LDL has a purpose as this, if we change the metaphor from baseballs to buses, and we say, well, the LDL is released from the liver and it's got all these passengers, fat-soluble vitamins like ADEK, and it's got CoQ10 and these other things. But also LDL is an antioxidant, and it's also part of the immune system. So if we have a lot of oxidative stress, well, we make more LDLs. If it's part of the immune system and our immune system is on high alert for a whole variety of reasons, again, LDL particles go up. And then ultimately, as our livers are so toxic, we've got problems with the clearance of old LDL particles. So they circulate around as small, dense LDL particles. Some of them will go through a leaky endothelium or blood vessel and create a more inflammatory response and ultimately wind up in disease. But yeah, that's the kind of whole process where, and what we're trying to find is, hey, what's the perfect cholesterol for you, me, and everybody else? And that's ultimately what the goal is.
Yeah. I've heard this multiple times now that it's really the inflammation that causes these problems. But when your inflammation is high, typically your cholesterol markers will be high. And so it's easy to confuse it with the cholesterol. Very, very interesting. So what about red meat, right? Now that's another common one that you hear all the time. Oh, red meat, is bad. What's your opinion on, you kind of mentioned eggs. I eat lots of eggs. What's your opinion on red meat and eggs and things like that?
Yeah, the dietary philosophy is interesting, and the debate is interesting, and a lot of people love to to talk about it extensively. But the red meat part of the story is, again, it's another vilification for false reasons, right? If you're the people who are in control of the United States and beyond, you don't make a lot of money by selling red meat. It's too, especially the good quality stuff. It's too labor intensive, cost, prohibitive, if you will, for a lot of people. So how do you really control the populace and stuff like that? Well, you feed them oatmeal and other kind of, these grains that, these companies have made just infinite amounts of money from. So red meat, especially when you're doing quality stuff. Listen, we are hunter-gatherers, right, Talora? We are hunter-gatherers. We were, we came from the Middle East. We spread around the world. We were hunter-gatherers all throughout human existence, from everything that I can read, everything that the anthropologists and paleontologists tell us, of which there are many, many, many people in those literatures. And then, of course, look at TV shows today like Alone, Naked and Afraid, Survivor. They become hunter-gatherers very quickly, or they quit the show, or they die. Like there's no bowls of oatmeal and walnuts that are there. They have to hunt and gather, and that's what they do. So it's just common sense things. All people in the history of the world were meat and or seafood eaters, and I think that that's the best way to go. But I will say one thing, no matter what dietary approach that people follow, make it organic. Get the chemicals out of your food, the pesticides, the artificial ingredients, the artificial flavors, the artificial sweeteners. Get the plastic out of your food. Let's all agree on that. So if you're like, I love oatmeal, just make sure it's high quality organic oatmeal. If you want to have ice cream, tonight for after your dinner, have organic ice cream. So let's start with that. But the big three things for me is always be organic, always eating regeneratively raised animal products. And my preference is for bison, and including the organs, specifically liver and heart and kidney, and then seafood. I happen to think seafood is the healthiest, most important food on the planet Earth. I understand concerns, and I think those concerns are real, but the benefits of eating seafood far outweigh any potential risks. And that's kind of where I would leave that story. If I might, Laura, one thing that I wanted to go back to our last, point on is that inflammation and oxidative stress are wonderful markers, and they're very good predictors. But ultimately, it's just a matter of what is causing inflammation and oxidative stress. The medical doctors know it's bad. They'll just reach for a statin drug as their, attempt at a solution. But what we do, obviously, in the holistic space is we go after what is causing the inflammation and oxidative stress. And to wrap up this one particular thought, for everyone who's listening, when you talk to someone, like you said to Laura, like people talk to you, they send in labs or they tell you about various complaints, and everybody's going to be going maybe for Thanksgiving dinners and it's holiday season. Whenever you hear someone complain, all disease, no matter what the disease, what the symptom is from two things: not enough of the good stuff, too much of the bad stuff.
Yeah, absolutely. And, I have a whole long history and story of how I healed myself from inflammation. We talk about it a lot. Most every disease stems from inflammation. And so you're a fan. It sounds like you're a fan more of like, at least I'm a fan of the like paleo style diets where it's like no added sugars, no processed foods, things like that. Trying to eat grass-fed, grass-finished, meat when you can. And it sounds like you're a fan of these foods. And what would you tell people? What do you think are some of the biggest culprits then that are hurting? If someone's listening right now, they're like, okay, what are some of the things I probably want to cut out of my diet that might help me in heart health?
Well, I think the grain category, certainly the gluten-containing grains, is a good place to start because there's really no nutritional benefit or need for anyone to have wheat, barley, rye, or corn, certainly not soy. And again, if you're going to do those things, you want to do them as clean and as organic as possible. So there's no reason for that whatsoever. I think those are big offenders. And then, as you said, processed sugar is going to be the other big offender. But I am a huge egg advocate. An egg is a cocoon for a baby chicken. Like, it contains all the nutrients that a chicken needs to come to life. I also like salmon roe for the same reasons, all the nutrients that a salmon needs to come to life. The other, things that, we do a fair amount of raw dairy in our house. I'm not a huge raw dairy fan, but my wife, the 4 kids, they like it. And I think when you do it in its raw state, it provides a lot of nutritional value, not necessarily Paleolithic, but most people can tolerate it pretty well. We've been having raw dairy for, 10,000, 15, 20,000 years. Of course, we had dairy from our mother when we were breastfed. And historically, that breastfeeding, we would have been having our mother's milk for 3 to 4 years. So our bodies are acclimated to it. Our bodies are not acclimated to wheat, barley, and rye. That is totally something that's brand new. You do get a lot of people who talk about carnivore. You talk about people, extremely low carb. I'm a paleo guy. Like I said, I'm a hunter-gatherer guy. And I see that in animals. A bear will eat salmon. It'll eat animals, and it'll also eat, berries and other fruits. The A lion will do the same. I see my dog. My dog is a meat eater, but then you may see the dog outside chewing on some plants a little bit to get some variety or for whatever reason. So I'm not one of those people who think plants are dangerous, for when you eat them organically. My day, typically, I'll start off with, a breakfast of maybe like salmon and eggs. I try and eat seafood every single day. Lunch may be a big salad, with anchovies or something like that. And then dinner, is what dinner is. But that's the way that I roll with it. I think it's not only the best way, but it's just the common sense way. You can read the books of, Captain Cook, Magellan, another wonderful read, Weston A. Price, Nutrition and Physical Degeneration. The guy travels around Earth by boat in the 1920s with his wife, and just the societies he comes across. It just is. It's kind of like, Talora, if someone said, hey, I got this new program and it's called the helium diet, and all we do is breathe helium instead of breathing air and oxygen, you would laugh at that person. Like, that's just not the way that we're designed. We're designed to be hunter-gatherers.
Yeah, I agree. All right. I have to ask you about statins. So you mentioned in your practice that you want to do everything you can. Prescription drugs are the last line of defense there. Do statins have a place? Are they overprescribed by most doctors? I was actually quite surprised. Dr. Peter Attia said that something like 70% of his patients over the age of 40 are, he puts on statins and things like that. And, you hear just such high numbers. I think it is the number one most prescribed drug, if I'm not mistaken. So what's your opinion on it?
My opinion is statin drugs are poison, and I don't prescribe them to anyone in any situation.
Wow,
that's
nice.
That just summarizes my position. Whenever I'm interviewed, people will invariably mention, Peter Attia or maybe some other cardiologist. There was a recent Instagram video where I was kind of tagged in it was a TikTok, and I was tagged by this cardiologist, and they mentioned basically calling for my license for not prescribing statin drugs. Like, that's the world that we live in, which should always be a freedom world. Hey, listen, you want to take statin drugs, go take them. You want to inject yourself with poison, go do it. But I'm not doing it, and you can't make my family do it. It's a freedom story. Now, as you said, Lipitor in particular, the atorvastatin is the generic name. Lipitor is the number one selling pharmaceutical of all time, generating $100 billion of revenue for Pfizer. So when you can generate that kind of revenue, I don't have to tell anybody here who's listening, that kind of money controls the data, controls the quote unquote science. And as far as I'm concerned, Peter Attia and others, they got it wrong. I'm not an integrative cardiologist. I'm a holistic. I'm a natural cardiologist. I don't like medications. I would never take a statin drug. I'd never recommend it to anybody. The evidence, again, we can debate the evidence, but we have to always remember that the companies who pay the doctors and the researchers, the PhDs to do the studies, they control the evidence. Do statins lower numbers down? Sure they do. But, Talora, I can remove your liver and your total cholesterol will go down very low and then you will die. You mentioned cancer people have very low cholesterol levels. The idea with statin drugs, again, they've got what's called pleiotropic benefits, and maybe they do. But my goal, Talora, is not how do we lower someone's risk of having a heart attack in the next 12 months from 2% to 1.8%. My goal is to make it 0%. With only positive side effects. Nobody walks out of the cardiologist's office and they're like, wow, I feel awesome on Lipitor. Like, everything's great. My libido's awesome. And my sleep is great. And I've, put on like 5 pounds of muscle. Like, nobody does that. It only makes people feel invariably worse. It leads to brain issues. It leads to muscular issues. You show peak performance. You get a lot of athletes. I just don't think it's a good strategy. And ultimately, if we are sick, it's not because we have a deficiency of statin drugs. The sickness, like I said, is from not enough of the good stuff, too much of the bad stuff. Disease can be viewed in the sense of these are violations of eating well, living well, thinking well. And I'll wrap it up to say my father took Lipitor, and I believe it was one of the things that helped to liquefy his brain. There is a steroid-like molecule that is essentially a fat molecule that is in the brain, in the substantia nigra of the midbrain, where Parkinson's and movement disorders stem from, and that is called dolichol. When you inhibit the HMG-CoA reductase enzyme with a statin drug, you inhibit the production not only of cholesterol, but also, everyone knows, CoQ10. It also inhibits heme A, which is part of the fourth cytochrome, the fourth enzyme in the electron transport chain. So you have lower levels of heme A. And then in the case of my father, it lowers levels of dolichol. And dolichol is found in the substantia nigra. So yeah, I'm pretty passionate about anti-statin. I don't think there's any value for anybody at any particular time. A lot of times people ask about another class of pharmaceuticals called the PCSK9 inhibitors. There's natural treatment solutions. Yeah, there's natural treatment solutions for that. The only one major study that I know of regarding PCSK9 is that it was released in 2017. I believe it was New England Journal of Medicine, either 2017 or 18. You can look it up. It's there, but it was a massive study where they looked at Repatha. Half the group got Repatha, half didn't. Everybody was on statin drugs, which means the data that they have is everybody's on statin drugs. And the Repatha group, they got to an LDL of around 30. And it turned out that there were less heart attacks and less strokes in the statin drug Repatha group. But the problem is 18 more people died in the Repatha group. Not statistically significant, but I would say it may be clinically significant to the 18 extra people who died.
Yeah, fair point. So you're not really a fan of, it sounds like you're not a fan of any drug that might just, artificially lower your cholesterol number without really addressing the root cause of the problem. Those could actually cause different problems, further problems, brain issues, mood, all sorts of different issues that we hear about. Right.
Well, I think also is that, so not only do the statin drugs not work, not only do they have a plethora of side effects, but it also leads to a false sense of security for a lot of people where they would think, hey, I can just take a Lipitor and eat whatever I want, live whatever I want. And I think, again, that false sense of security, I believe, has really led to millions of people not getting the truth. And then, of course, millions of people dying because they did not hear the truth on that. The other class of pharmaceuticals, which is a total sham, is the blood pressure drug class. If you have high blood pressure and you're on a pharmaceutical, it's just not good. The literature supports that data. Journal Hypertension 2019 had a really nice review and actually showed that the people at the highest risk of cardiac events were the people with normal blood pressure on blood pressure drugs. So. It's and again, it's just if you have high blood pressure, you got to figure out why, and it's not because you're deficient in blood pressure drugs. There's a reason why this is going on with the body, and you got to fix it. Let me say one more thing too: is like people with atrial fibrillation, they can go for an ablation procedure, and the ablation may or may not be successful. But people with atrial fibrillation, they also have a higher risk of cancer and a higher risk of dementia. Now, AFib doesn't cause cancer, but whatever causes AFib also causes cancer and also causes dementia. So you'll be someone who goes for an ablation and maybe you don't have AFib, but if you didn't address the root cause, which people don't, you will wind up very soon with cancer and dementia. So it is always about root cause medicine. And to say it again for the third or fourth time, this is just common sense. That the medical doctors were never trained in common sense. These are smart people that have just been, it's kind of like if you speak Hebrew and I go to Israel and I'm walking around and they're like, wow, this guy, Jack Wolfson, he's an idiot. He doesn't speak the language. I'm not an idiot. I just never learned to speak the language. And the medical doctors have never learned to speak the language. I can't really speak for Peter Attia. I can only say that for someone like Attia, that he goes into the research, and he just views it differently than I do. And I think what Attia would say is, I'm going to try and achieve the best of both worlds. I'm going to talk about nutrition. I'm going to talk about lifestyle, and I'm going to throw in, some statin drug on top of that. I just don't believe in that. One final thought. I tend to bag on the medical industry a lot. But again, it's not really their fault. It's just the way that they're brainwashed, the way that I was into that as well. God bless the men and women who work in emergency rooms and trauma centers. They're really doing some amazing stuff. But when it comes to the prevention and the reversal of chronic illness, I mean, we've got nothing. These doctors have nothing.
Right. Yeah. Really, really great points. So kind of, again, we talked about, obviously there's exercise. Do you have any kind of preference in terms of exercise that you've seen be better for heart health? Is cardio or weight training or a combination of both? Do you have any preferences there?
Well, I think that exercise should be fun, first and foremost. It should be done outside, second. So mountain biking, hiking, stand-up paddleboarding, kayak, just physical activity outdoors, I think is good. The more time we spend outdoors, the longer we're going to live. The other thing that I like to get people, any kind of movement is good, right? So whether or not we're talking about, going for a jog or a hike or a bike ride, or we're talking about doing yoga, tai chi, or we're talking about high intensity interval training, run, slow down, high intensity interval training that has plenty of data. But I think also is that where a lot of people are really moving towards, I'm sure you understand this as well, is just they're moving towards the movement, just like the physical movement of how we move. And that may be things like crawling on the ground. It may be, walking around, like a monkey, these kind of, primordial movements that we have totally lost. And as we get older, they become very, very, very difficult to reclaim. So I think that kind of the idea of these are somewhat similar to yoga moves, but maybe if a lot of people, the spiritual side of yoga is like a deal breaker for them because that may conflict with their, Christian beliefs or, Judeo-Christian beliefs, so they won't do that. So it really is about movement. And there's some really good movement gurus that are out there. And I think that is going to be the best form of physical activity. Maybe movement started from an Israeli as well, Ido Portal, and the stuff that he did, and then some of the people who kind of learned from him and moved out from there. There's some really good apps, but it really is just as simple as just kind of getting down on the ground and just exploring your body's ability to move. And that's kind of my long-winded answer there. I hope that helped.
Yeah, no, that is helpful. And any kind of movement is great. I agree with you. I actually been saying to myself, I need to do more mobility. I feel more stiff. I'm not, like as limber as I used to be. And I wasn't doing it on my own. So I literally have a trainer once a week. I know how to lift weights. I don't need the trainer for that. I have a trainer to help make me do mobility and all sorts of weird core stuff and weird movements that I would never do on my own, just to kind of keep that in there. So yeah, I love that. I know, going back to kind of some of the health aspects, it sounds like with the seafood, there's a lot of omega-3 in there. So it sounds like you're a fan of omega-3. It's interesting, the beef, or not the beef organs. In your case, you've mentioned, I think, bison organs, right? We hear a lot about liver, specifically beef liver. I actually haven't heard too many people talk about bison, but whether it's liver, heart, and I was always kind of curious about this myself. Like, do you think that when people say you should consume heart, does consuming heart actually help your heart? Is there any evidence behind that? Or is that just kind of like a theory that people think like, oh, if you eat, bovine grass-fed heart, it's good for your heart?
I'm not sure how much evidence there really is on that outside of, the obvious that if we're trying to build the strength of our hearts, like somebody with heart failure, for example, if we're trying to improve the heart function, well, why would we, from a food standpoint, not consider that heart would be the best thing to eat? So if we're thinking, okay, well, maybe I've got a CoQ10 deficiency in my heart. Well, where's the best source of CoQ10? It's going to be from eating the heart. That's kind of where a lot of that starts. Now, is there something a little bit more, quantum level behavior of that if we're consuming heart, that benefits our hearts? Yeah, I think there's probably something to that. And I would never deny anyone who believe that to be true. There was the idea that a lot of people, they were doing small amounts of of glandulars to make changes to the, kind of macroscopic organ. And I believe that part to be true. Back to omega-3s, like the only place you get omega-3s is from eating seafood. Omega-3 fatty acids, along with cholesterol, make up the cell membrane, the fence that surrounds the cell, of course, and all the organelles. People with the highest levels of omega-3 fatty acids in their blood from eating seafood have the lowest risk of everything, whether it's cancer, heart disease, COVID, anything else like that. Like that's in the literature. So yeah, that's why I'm a big fan of seafood.
Yeah, nice. And then liver, I think, is known to have a lot of nutrients in there as well, right? A lot of B vitamins and things like that in the liver.
It's got everything in there. I mean, liver has got all the fat soluble vitamins, A, D, E, K. It's got the B vitamins that are in there. It's got the CoQ10. It's got the glutathione that's in there. And glutathione is the body's main antioxidant that our liver makes. So you'll get that also from eating the animal organ as well. All the different proteins that are in there. It's a complete set of complex proteins. And if you just look at nature, when an animal kills another animal, it doesn't think about where the fillet is or how to make a ground beef patty. It thinks about where are the organs and how can I eat those organs as fast as possible. If we take liver and we feed that and we throw that out to the chickens amongst the entire carcass, like that's what they'll eat. They'll eat. It's interesting that the animals, they'll go for those organs, specifically liver. The other things they would go for is the brain. So I watch our cat eat, and our cat hunts mice. And the first thing that cat does, it chews the head off and just eats the brain. First thing that it does. The next thing you know, you're looking around your house and you find all these, headless mice laying around because that's what the cat does. Cat's not making mistakes. Cat doesn't need to be told what to eat. Lion doesn't need to be told what to eat. It's very, very, very simple. It really is.
Yeah. One more thing I wanted to circle back to. We covered cholesterol. We're pretty clear on your opinions there on statins and cholesterol. You touched on blood pressure, and I was actually a little surprised on, because that one where it's like when someone has high blood pressure, it could be really detrimental. And the medications seem to work to get the blood pressure down in some cases. But if someone listening, again, blood pressure is one of these things where I actually have always said, I personally believe that blood pressure is one of those that has the most to do with your own internal state and how you process stress and how you deal with stress. But I'm curious, probably a lot of people listening now that might have high blood pressure, might be on high blood pressure medication. What are some of the things they should be looking at or doing that you've seen naturally improve blood pressure?
Well, remember, blood pressure is not from a deficiency in blood pressure drugs. It's from a violation of eat well, live well, think well. So it's the deficiency of the good foods and the good lifestyle. When I think about blood pressure, I think about the importance of sleep, going to sleep with the sun down, awaking with the sunrise, avoiding artificial technology, blue light, especially at night. It's about getting the sunshine. Sunshine hits the skin. Of course, it creates vitamin D. It also produces nitric oxide, which is a vasodilator. Sunshine during the day also leads to melatonin production that's released at night, and melatonin also helps to lower blood pressure down. When I think about all the environmental toxins that are in the literature that lead to hypertension, high pesticide levels, plastic levels, phthalates, parabens, VOCs. Another big category, mold mycotoxins, bacterial toxins. These are things from water-damaged homes, which is the subject of a semester course just on mold and bacterial contamination of a home from water damage, on the ill effects of that. I think about how chiropractic care is proven to lower blood pressure by 17/10. I think about holistic dentistry. And taking care of your teeth and getting rid of root canals and not having root canal teeth and metal amalgams, things like that, gingivitis and dental diseases. Back to the sleep, I think about sleep apnea, which clearly drives this high blood pressure as well. And then the lack of movement, right? Just everybody's sitting and they're just not moving. And when you're not moving, it leads to your spine becoming stiff, which is one of the reasons why chiropractic is good. But the spinal stiffness has been correlated with stiffness of the aorta. And if you have a stiff aorta, that will come across as high blood pressure. And the answer, like I said, it's not pharmaceuticals, not going to work. The answer is to improve all of that, eat, live, and think, because you mentioned stress, which is a massive, massive, massive factor of all illness. And then you can get in and do the most advanced testing in the world. Maybe it's a magnesium issue. Maybe it's not. Maybe it's a potassium issue. Maybe it's a B vitamin issue. Maybe there's other things that we're missing. And then can you use evidence-based supplements like magnesium or potassium or, whey protein shakes or, organ supplement, whatever it may be. And then what are the biohacks? Can you do like a red light therapy? Can you do sauna? Can you do ozone? Can you do like various techniques that would help? And that's what I would prefer certainly to the pharmaceuticals.
Amazing. Dr. Wolfson, this has been great. Do you offer telemedicine or is there somewhere where people from other parts of the country can work with you, or tell people a little bit about any programs you have or any way that they can work with you and find you?
Yeah, the best thing to do is go over to Natural Heart Doctor. You can start off with a free discovery call. You'll see that on the website. So that's kind of one way to dive into it. No matter what your problem is from a heart standpoint, I've tried to kind of build up as much content there that I can to show that there is a natural treatment solution for people. And I do telemedicine. We have another cardiologist, Dr. James Kneller, who works on the team. We've got a team of naturopathic doctors, and we've got health coaches around the country. So hopefully we have enough different touch points, and we've got some courses on cholesterol and blood pressure, and some others as well. But if I could leave everyone, with just there's always an answer to at least supporting you. And sometimes it may be in conjunction with pharmaceuticals, but the idea should always be, how are we safely removing the pharmaceuticals from someone? Because if you're on pharmaceuticals, you're just not going to live long. It's just life expectancy of a woman in the United States is in the late 70s. Men, it's like mid 70s. That's not good. That's just not good enough. It wasn't good enough for my father, who died at 63. It's not good enough for me as a husband, as a father of 4 children. So we want the best for people, and we at Natural Heart Doctor are available.
Amazing. And it sounds like this could be a great fit for someone who's been on maybe statins or blood pressure medication for an extended period of time, and they're saying, I really want to get off this thing, but I'm afraid because my doctor says I have to be on it, right? And so now maybe this is an opportunity for them to work with a doctor. I always find that this is it's tough to tell people. First of all, I don't tell people, but in general, right? It's tough for people to go against what the doctor told them, right? But now if they have another doctor who has a different viewpoint, who can maybe help them wean off or go to lower doses and maybe eventually wean off in a healthy way where they're not compromised and they can feel comfortable knowing that they have someone like you with the experience and the same medical knowledge, behind them. It sounds like that could be a great fit for someone like that.
Well, it should be a choice amongst the individual person. So again, if someone wants, Lipitor, then they can go to see, Peter or Tia, but they shouldn't have to, they should have a choice. Just like, again, if you went and you hired a real estate agent, and you're like, I don't like the person, I don't like what they're showing me. Well, then you would get rid of the real estate agent or try and get them to change. Doctors aren't going to change. So you have to move on from that. You listen to Talora's, podcast here, you like it, you stay with it. You don't like it, well, then move along. And that really should be how it is with doctors. Doctors are notorious at being bullies. We should not be bullied. We should be informed, and we should work with people who we resonate with, who respect what our opinion is and willing to have these conversations. But, ultimately we do a lot of second opinions for people who've already had cardiovascular events or diagnoses. But my favorite is, hey, who's the 35-year-old person who has a family history of heart disease and they don't want that to be them? And I'd love to reach those people in a proactive fashion, just so they don't have, these endpoints, really to make sure that they're dialed in, and testing to make sure that they're on track. Again, that's just, who I love to work with in that sense. I'll say one final thing for everyone's genetics. Why is everyone's genetics are perfect. Your genetics, Talora, are perfect. Mine are perfect. Family history is true. As far as we eat and live like our family did, and like I was following in my father's footsteps, but our genetics are perfect. We're not genetically programmed to have heart attacks, strokes, cancer, kidney disease, brain disease. There's some rare exceptions, which I believe are, for the most part, caused by some environmental toxin that led to chromosomal abnormality or a genetic SNP and stuff like that. I think we can always blame it on that. We are genetically programmed to live a long, healthy life.
Love that. Absolutely love that. It's a great place to leave it. Check out naturalheartdoctor.com. Again, he's offering actually a free consultation for you if you're interested. Dr. Wolfson, this has been a great, great episode. It's really important. I can't wait. I'm going to share this episode with so many people who every week or every month contact me and ask me questions. And I'm like, look, I'm not a heart doctor. Here's the link. Listen to this episode because this has been very, very valuable. I think people will get a lot of value out of it. So thank you so much for sharing your knowledge and for everything you do. And I hope we could do this again sometime.
No, my absolute pleasure. And again, based on our conversation here, and I know the people you've interviewed in the past, I would sooner send people to you for health advice than any other cardiologist I've ever worked with, because the other cardiologists don't have a clue. So I would say, hey, listen, you want nutrition advice? Yeah, go listen to Laura over your local cardiologist, for sure. Because these are just common sense approaches that are just focused on ancient wisdom, and they work. They always have worked, and they always will work.
Appreciate that. Well, thanks again, Dr. Wolfson, and we'll talk to you soon. Thanks for listening. If you enjoyed the episode, can you please leave us a rating or review and subscribe? I've realized that while we have actually increased our downloads a lot, we're actually getting a lot of downloads, which I'm really happy about. We actually have very few ratings. And I realized that I've never asked people really to rate much. So I'm asking you now if you could please rate and review and subscribe. And if you enjoyed the episode, please forward it along to anyone that you think will get value out of this. Also, if you haven't checked out our line of products at buypeakperformance.com, you get 20% off your first order. That's www.buypeakperformance.com. We have some incredible products, including our organic high-altitude coffee. If you don't know this, coffee is one of the most heavily sprayed with pesticides out of any crop. So it's really important that you drink organic coffee. We've gone above and beyond to source what we believe is the highest quality and healthiest organic coffee in the world. We're also famous for our organic green superfood powder. You can get 20% off of that as well at buypeakperformance.com. We also have an organic vegan and paleo plant protein. See, most of the vegan proteins out there are using brown rice protein, which is really not a good source of protein, and it's also a grain. And if you're paleo, you know that grains tend to cause inflammation in some cases for some people. And so we wanted to make one that was paleo friendly and vegan and organic. We made an amazing amino acid profile, so it's really one of the best plant proteins for muscle building. So you can check out Peak Performance Organic Plant Protein. You can find that on our website. Of course, all our products are on Amazon as well. So thanks again. And again, please, if you enjoyed the episode, please forward it along to someone who you feel can get value out of it. And please leave us a rating, review, and subscribe. Thank you.